Good afternoon, everybody, and apologies for the late start to this session today. A few technical problems, but hopefully they're all resolved now. So I'm Rachel Scantlebury. I'm a public health consultant in the Lambeth Public Health team, and this is the NHS South East London Clinical Commissioning Group Facebook Live event on the COVID-19 vaccine for 12 to 15-year-olds. I'm really pleased to be joined by Dr Sara who will introduce herself in just a moment. So just wanted to welcome everybody. So as I said, I'm Rachel Scantlebury. I'm a public health consultant in the Lambeth Public Health team. This event is one of a few which we are running to give parents, carers, children and young people a chance to ask any questions that they might have about the COVID-19 vaccine, which has started being implemented across the UK and in some schools in South East London, and other schools will be having theirs soon. So we know that lots of parents have got lots of questions. So this is really a chance for you to ask those questions, and we're really pleased that we've got an expert with us today. I'll just also say that I'm a parent myself. I've got 2 children. One of them's 14, so he's in that age range, so he's eligible and he's due to have his vaccine through school in a couple of weeks. So if I just hand over now to Dr Sara.
Hi, thanks very much for having me, Rachel, and the South East London CCG. I think it's such an important chance and opportunity that we've got today to try and answer some questions, some concerns that parents or young people might have about the vaccine. So I am a GP and I work in Lewisham. I'm also a clinical fellow for North Lewisham, looking at community engagement for young people. So this is a topic that's really kind of close to my heart and something I'm really passionate about. So yeah, what a great opportunity we have today.
That's great, thank you. So please do put your questions in the chat. There should be a chat box somewhere on your screen. So please do feel free to put your questions and we'll try and get through as many as we can. This session is due to last about 20 to 30 minutes or thereabouts, but the live chat will remain accessible so people can look at that later, and there still will be the opportunity to add some questions there if you're unable to add them whilst we're live this afternoon. So also the other thing to say is that the South East London CCG website is a really good place to go. It's got a good vaccine section with lots of frequently asked questions. So there's an opportunity there to find answers to your questions as well if we're not able to cover it today. So while we're just waiting for some questions to come through, perhaps I could start with asking 1 or 2 questions that we know have come up from parents before and might be the kind of questions that parents here will have. So perhaps we could just start by talking about what is the vaccine that people will get. Is it AstraZeneca? Is it Pfizer? And about the dosage, how many injections should people be expecting?
So as far as I'm aware, for people in this age group, for young people, it's Pfizer mostly. There may be some Moderna available. If you're aged 12 to 15, you're looking at 1 single dose. And if you're above that age group, it should be 2. Certain people above 16 who are vulnerable may get a 3rd dose or a booster dose as well. It really depends on your kind of vulnerabilities, your susceptibilities, and if you've got any questions about how many doses you might need, please do get in touch with your GP, because they can always look through your health record, answer any questions you have, and kind of let you know what you're eligible for.
That's really helpful, thank you. And is it right that if you're in that 12 to 15 range, but you've got some underlying health conditions, it might be that you need 2 doses of the vaccine?
Yes, absolutely. Sorry, I should have made that clear. Yes, absolutely. If you've got certain health conditions, then you will be eligible for 2 vaccines if you're in that age group. And if you're not sure, absolutely, please do get in touch with the GP, because they can always let you know kind of what you're eligible for.
Thanks, Sarah. That's really great. So we've got a couple of questions that have come in. The first one says, when can I get the vaccine as an under 18-year-old?
So again, it depends on your age group. If you're above 16, you're eligible now. So, and there's loads of different places that you can get the vaccine. So it could be a pop-up clinic locally, it could be a vaccine bus, it could be your local pharmacy, it could be a GP hub. So if you're above 16, the best way to if you've not had your vaccine yet, is to just go onto the NHS website and you can type in your postcode and get booked in that, or attend a walk-in. If you're 12 to 15, as Rachel said, the programme is starting to roll out in some schools and will be in other schools across the kind of autumn time. And so you should be contacted by your school, and they will be making preparations, if they haven't already, for when that will be.
That's great, thank you. And there's another question come in which says, who will be delivering the vaccines for their children? So is it school nurses, or is it for children and their parents to find somewhere that will administer the vaccine to them?
So if you're 12 to 15, the school is making arrangements, and there will be staff who are trained in giving the vaccine, similarly as they would be in a local pharmacy or GP hub. So whoever's giving the vaccine is trained to do so. And again, if you're over 16, there are slightly different facilities available for you, whether that's a vaccine bus or a pop-up as well.
That's great, thank you. That's really helpful. So a question that I've heard quite often is, if my child has had COVID in the past, do they still need to have the vaccine?
This is a really good question, and we get a lot of adults asking this question themselves as well. I would say yes, absolutely. I would encourage as many people as possible to get the vaccine as quickly as possible. The reason there is really twofold. Whilst you may have had COVID in the past, you can catch it again, unfortunately. And so that's why we're encouraging people to get vaccinated, even if they've had COVID in the past. The second reason is that you're protecting not only yourself, but others around you in our society who are susceptible, who are vulnerable, whose immune system perhaps doesn't work as well as it should do, who are vulnerable to catching COVID. So yeah, I would really encourage everyone to get vaccinated. It's our best line of defense against the virus.
That's great. There's another question that's come in which asks, if somebody's child has just had the nasal spray, and I'm assuming that means the flu vaccine, how close to that can they have the COVID vaccine?
This is a really good question about logistics, and it's really great that your child has had the flu vaccine. Well done for doing that. It's 7 days apart for the nasal flu vaccine and your COVID jab. So as long as you're out of that window, it's safe to be given.
That's great, thank you. Which reminds me of another question which I've heard quite often, which is if somebody's kind of very recently had COVID, or if they've got COVID, should they have the vaccine?
Again, a really good question about kind of the kind of nitty-gritty of how to get the vaccine done. If you are recently unwell, or kind of unwell when your vaccine is due, I would say it's best to wait until you're fully well. If you've had COVID within the last month, again, I would wait until you're out of that month period, just to give your immune system the best fighting chance to mount a response to for when you have the vaccine, so that your body is ready to fight if you come into contact with the virus at a later date.
That's great, thank you. So I know that some people may be just joining, so just for anybody who has recently joined, just to remind you that this is the NHS South East London Clinical Commissioning Group Facebook Live session on the COVID-19 vaccine programme for 12 to 15-year-olds. And we're really pleased to be joined by Dr Sara to answer all of your questions. Another question that's come in, as a younger person, do I need to be vaccinated?
So the vaccines are not compulsory, they're not mandatory, they're just being offered. But I would really encourage you to think about having the vaccine. The JCVI, which is the kind of committee and organisation here in the UK that weigh up the evidence and the pros and the cons about having the vaccine have said that on balance, for young people, it is a positive thing to have the vaccine and outweighs the cons of having it. But again, I would really encourage you as a younger person to kind of really reflect on what you're doing here, and actually that it's something quite heroic to have the vaccine, that you're not only protecting yourself but protecting others in our wider community and our wider society who are vulnerable. And by having the vaccine, we're trying to reduce the amount of virus around, and reduce the amount of cases, and reduce the spread to other people. So it's something that's it's a really I would say it's a really big deal to be doing this, not only for yourself but for others around you, and actually something really heroic.
That's great, thank you. Another question's come in, so please do keep putting your questions in the chat. If your child requires a second dose due to being immunosuppressed and your GP isn't providing the second dose, where can you get it from? Are there other places?
So this is a really good question. There are spacings between the doses. So it may just be that part of the program isn't yet up and running at your local hub, but I would let your GP know, and they can make a note of that, and you should be contacted when that second dose is due for your child.
That's really helpful, thank you. And another good question that's come in asks, why is it that adults might need a third booster, or some adults are having a third booster vaccine? These young people are only recommended to have a single dose.
This is a really good question. This is all about kind of the severity of the disease and how it affects people dependent on their age groups and their particular vulnerabilities. Obviously, we're still living through this pandemic and we're still gathering data as we go along. But what we've learned over the last 18 months is that older people and people in certain health conditions, or people with certain health conditions, I should say, they require further doses to make sure that their immune response is what it should be. So what that means is if they come into contact with the virus, if they've had multiple jabs of the vaccine, it gives them the best fighting chance against it, to try and reduce how severe COVID is for them. As a younger person, usually your immune system is stronger, and so you're only needing one dose of this to give yourself immunity, but also to reduce your chance of spreading it to other people.
That's really helpful, thank you. Please do keep putting your questions in the chat if you've got any questions for Dr. Sara. A question which I know comes up quite often is about any side effects or any possible complications after the vaccine. Is there any advice you can give on that?
Yeah, so again, a really good question, because obviously there's a lot of information out there, and people who've been vaccinated have described a kind of variety of side effects. What I would like to do is to reassure people that for the overwhelming majority, these side effects are mild, usually lasting only a few days, can be managed at home with something like paracetamol. You may find you feel a bit flu-like, you may find you're a bit shivery, feverish perhaps, or develop a cough or a snotty nose, or have an ache in the arm. But for the overwhelming majority of people, these are very mild side effects lasting only a few days, and can be managed safely at home.
That's really helpful, thank you. We've had a question come in asking which type of vaccine is available to under 18s. Perhaps you could just remind us again what are the vaccines that the under 18s would be offered.
So we touched on this earlier, but just to recap, as you said, for the majority of young people, it will be Pfizer, but there may be some Moderna available as well.
That's really helpful, thank you. And thank you for covering the question about sort of the immediate side effects. I know that some people are worried about the extremely rare chance of anything a little bit more serious. And I understand obviously that the risk of that is incredibly small, and smaller than the risk of those same risks from COVID itself. But is there anything you can say about these more serious but rare side effects?
Yes, so there have been some documented cases of potentially more serious side effects after having the COVID vaccine. They are extremely rare. We know that in the short term, people are recovering well. So it's just to say, if you do experience anything more than just a few days of kind of cold or flu-like symptoms, then absolutely please do seek medical help. But what we know is that these are looking like they're very short-lived.
That's really helpful, thank you. Another question asks, is getting the vaccine at school as safe as having it at a GP practice?
Absolutely. So the NHS has done something really amazing over the last 12 months in rolling out the vaccine programme across the country. But we've not done it alone. We've done it in collaboration with community groups, with youth groups, with pop-up venues, and now we're doing it in collaboration with schools. So absolutely, it's as safe as getting it done at your local pharmacy or at your GP hub. The staff who are giving it are trained to give the vaccine safely. That's
great, thank you. Someone asks a question, can I still catch COVID after I've had the vaccine?
Unfortunately, the vaccine is not 100%, so you can still catch it. But what we do know over the last 12 months of this vaccine being given out globally is that it does reduce the severity of COVID, and it does reduce the numbers of people needing to go into hospital with COVID, and it does reduce the numbers of people dying from COVID. So whilst it may not prevent you from catching the virus 100%, it does reduce the numbers of people who catch it, as well as the people who go on to become very unwell with it.
That's really helpful, thank you. I'm just looking at some other questions that we've got. But actually, before I do that, I just thought I'd add to your last point. You make a really good point that this vaccine's been delivered worldwide to a huge number of people, and that includes to the 12 to 15 age group. So although in England and in the UK, it's relatively recently being started to be actually administered to young people, from many countries across the world, they have been delivering the vaccine to 12 to 15. So there is a huge amount of data internationally about how children respond to the vaccine, which is really helpful. Okay, a great question here. What if my child turns 12 in January and misses out on the vaccine this time?
So I would encourage you to talk to the school as well as your local GP about what the upcoming plans are. It looks like it's an evolving vaccine programme. So whilst your child may not get it this autumn, I imagine as things progress, there will be more rollouts of the vaccine. We do want as many people as possible to get vaccinated, and as quickly as possible to reduce people's vulnerabilities to the virus. So I imagine there will be further programs coming up, but we're just trying to vaccinate as many people in the run up to winter as we're still in the middle of the pandemic.
That's really helpful, thank you. So I think we've probably got about 5 minutes left. So if anybody does have any questions that they haven't had a chance to ask yet, please do feel free to put it into the chat box and we'll try and answer as many as we can. I have another question here which asks about new strains of the virus. Do you know anything about whether vaccine might protect against any other strains or variants that we might see in future?
Oh, this is a good question, and I know that lots of scientists are working on this exact question at the moment. What we do know about the vaccines that we've got, and particularly Pfizer, there's so much evidence out there that they know that it's over 90% effective on the Delta variant, which is the looking like the main variant kind of globally now. Obviously, kind of the development of new variants can be quite a kind of scary thought for people. But we have, the data that is being collected kind of in real time about the variants that are out there through the testing that we do here in the UK, but also globally. And I know that scientists are working on developing vaccines that are effective for the kind of any new emerging variants. One theory that is possible is that actually we have booster jabs in the future if there are new variants emerging. So it is definitely an evolving picture, and we are living through it in real time in a way.
Thank you. And another question which I know lots of people will ask is, what's in the COVID vaccine? In particular, do they contain pork or do they contain egg? And I suppose that's related to, well, for various reasons, but one of the reasons for asking might be about allergies.
So what we do know, particularly with Pfizer, is that if people have any kind of common allergies, so things like bee stings or wasp stings or particular medicines or food things, it is safe for them to have the vaccine. So common things like soy or nut or milk allergies, that's absolutely safe for you to have the vaccine. If you do have any questions, though, please do get in touch with your GP, and they can talk in more depth with people about their particular allergies or particular health concerns. That's great, thank you.
And of course, you can get in touch with your school IMS provider. So in different parts of South East London, it may be different parts of the NHS that are providing the school IMS, but your school will know the details of who that is. So you can get in touch with them to ask any questions as well. So another question here is, my son has asked for me to be with him when he gets the jab. Will that be possible if he has it at school, or should I take him outside of the school?
This is a really good question, and again, sort of depends on how old your child is. If he's within the 12 to 15 age group, I would have a chat with your local head teacher, with some of the teachers at school, and talk about the logistics of how that is going to be rolled out at the school, and what procedures are in place for children who are a little bit nervous about having an injection. If your child is over 16, and it's happening in a pharmacy or a GP hub or even a pop-up, absolutely, please do go along with them if they're feeling nervous or feeling worried. You can be there with them, hold their hand, and be their support. That's absolutely no problem.
Thank you. And are you able to say anything about consent? So if the children and the parents maybe disagree about whether the young person should have the vaccine, what would happen in that situation?
So I think it's really important, if you are a parent, to have this conversation with your teenager and with your child, and to really kind of explore both sides of the story, and to really explore how everyone is feeling about this vaccine. If you're a parent and you don't want your child to have the vaccine, it does require your consent. But I think if your child really does want to have it, I would really encourage you to perhaps make an appointment at the school, or make an appointment with your GP all together as a family, and to really talk about the pros and cons and why people are feeling that way. I think, the more we can talk about the vaccine and people's concerns and questions, the better for everybody, because actually there is a lot of misinformation out there, and it can be really confusing to know where to get your information, or to know quite what the truth is out there. And so actually having an open and honest discussion as a family, and with a health professional or with the school as well, I would always encourage that, because you can then explore your concerns and explore your emotions about it in an honest and open environment.
That's really helpful. Thank you, Dr. Sara. So I think we're just about out of time. I think we've managed to answer quite a few questions there. So thank you to everybody who's joined. Thank you for putting your questions in the chat. This Facebook Live will be available to view afterwards, so you can look back. You can also keep putting questions in the chat. Remember, the NHS South East London Clinical Commissioning Group website has got a really good section on vaccines and frequently asked questions for all age groups, but there's a particular section around the 12 to 15-year-olds, so you may also find answers to your questions there. So I'd just like to thank Dr. Sara for joining us today. It's been incredibly helpful to have you here. and please do have a look at the questions. Please do, keep researching, and thank you very much for joining us today, and I hope you enjoy the rest of your Friday. Thank you. Goodbye.
Thank you. Bye-bye.